For years, the standard medical advice for peripheral neuropathy was simple: manage the pain because the damage is permanent. But under the right conditions, peripheral nerves can actually regrow, sending out new, healthy branches from damaged endings. Researchers at the University of Utah proved this in 2015. After putting patients through a specific exercise program, they took skin biopsies and physically observed new nerve endings growing back. To trigger this regrowth, we have to look at what causes the damage in the first place. High blood sugar literally glues nerve proteins together. This process, called glycation, chokes off the nerve pathway. Once these pathways are bound up, the signals traveling from your feet to your brain get scrambled. Instead of transmitting clear information about temperature and texture, your brain receives erratic noise, which you feel as burning, tingling, and numbness. The Utah study didn't rely on complex equipment. It used a foundation of cardio and balance exercises. The 15-minute routine we're using today is built from those same clinical protocols to stimulate that specific regrowth. You don't need a gym membership. You only need a sturdy chair, a flat towel, and absolutely bare feet, so you can maximize the sensory feedback from the floor. Treating neuropathy requires active participation. Rather than trying to mask the pain with medication, this daily movement mechanically forces those dormant nerve pathways to rebuild themselves. The routine begins with a seated march. This acts as the mandatory cardio foundation, safely increasing blood flow to your extremities without putting you at risk of falling. Sit up straight in your chair without leaning against the backrest. Lift your knees one at a time and swing your opposite arm with each step. Keep a steady pace for 3 to 5 minutes until your breathing picks up. Now that your blood is circulating, we target proprioception. This is your body's sense of spatial awareness, its ability to know exactly where your feet are without looking, which is the exact sense that neuropathy destroys. Stand behind your chair and hold on. Shift your weight and lift one foot just an inch off the floor. Hold this position for 30 seconds to force your ankle to make constant micro adjustments. As you get stronger, progress by taking one hand off the chair, then both. Eventually, you want to close your eyes. Removing that visual safety net forces your damaged nerve pathways to work harder to keep you upright. Next are heel-to-toe rocks. Stand with your feet shoulder-width apart. Slowly rock back onto your heels so your toes lift up. Then smoothly roll forward onto your toes. Complete 15 slow repetitions. The deliberately slow speed is the entire point. Every single rock forces your feet to constantly send physical location signals back up your spinal cord. These first 3 exercises build an early warning system. By retraining your brain to accurately sense the floor, you directly prevent the catastrophic falls and bone fractures associated with severe neuropathy. Next, we move to calf raises. Still standing behind the chair, slowly rise up onto your toes. Hold for 2 full seconds at the top and smoothly lower back down for 12 repetitions. This diagram shows how your calf muscle acts as a biological pump. When it contracts, it pushes deoxygenated blood up and out of your legs. When it relaxes, it pulls fresh, highly oxygenated blood down to your starving nerves. Return to your chair for towel scrunches. Lay a flat towel on the floor, place your bare foot on the edge, and use only your toes to grab, squeeze, and pull the fabric inward. Do this 10 times per foot. At first, it might feel like your toes simply aren't listening to you. That is completely normal. That frustration is the physical sensation of your brain attempting to reconnect to deadened pathways. When the towel becomes easy, you can increase the fine motor difficulty by picking up small objects, like marbles or coins, with your toes and moving them from one pile to another. The final exercise is ankle circles and the alphabet. Lift one foot off the floor and rotate it 10 times in each direction. Then trace the letters A, B, and C in the air with your big toe. Tracing different letters forces the small muscles in your lower leg to engage from unique, unpredictable angles, working every part of the joint. This highly specific footwork moves beyond simple circulation. It forces the brain to relearn how to control these small muscles, turning erratic noise back into precise motor signals. To maximize the effect of these exercises, your nerves also need 2 specific chemical supports. You should have your doctor check your vitamin B12 levels and ask about supplementing alpha-lipoic acid. This chart from a series of clinical trials illustrates the impact. It shows that patients taking 600 milligrams of alpha-lipoic acid daily experienced up to a 50% reduction in their baseline neuropathy pain and tingling. When beginning this protocol, follow a strict rule. Start at half. If the routine calls for 12 reps, do 6. Damaged nerves require gradual progression and consistency, rather than sudden shocks of intensity. You must also perform a daily post-exercise safety check. Take 1 minute to visually inspect the soles of your feet. Because your sensation is compromised, you need to look for hidden cuts, red spots, or blisters that you physically cannot feel. When dealing with slow-healing nerve tissue, 15 minutes of consistency every single day is scientifically superior to an hour-long workout once a week. When you combine targeted daily movement with these specific chemical supports, you aren't just waiting for the damage to worsen. You are actively providing the physical and chemical environment your nerves need to heal.